Like a mighty river that supplies many streams, our health affects so many aspects of our lives. Thus, the mission of the Health Ministries Department of SSD is to promote an integrated wellness lifestyle so church members and local communities may live healthy and vibrant lives. With the theme of every church a community health center and every member a health minister, we build upon the world goal to reach up, reach across, and reach out. Health seminars, congresses, camp meetings, emphasis weeks, and many other health avenues have been used to meet the goal in all unions, missions, and conferences. After lifestyle clinical training by the SSD Health Ministries Department in 2010, the Myanmar Union Mission Health Director was inspired to offer similar training to her missions workers and church members. The Southeast Asia Union Mission conducted a planning and renewal retreat for health leaders in Peninsular Malaysia Mission, or PEM. The Pakistan Union Mission held health seminars for Pakistan Adventist Seminary and college workers. This message was then shared through a health emphasis week in schools and churches. An intentional health program for all North Philippine Union, or NPUC workers, was introduced in all conferences and missions and involved seminars, physical examinations, and lifestyle modifications. NPUC led the way by providing pedometers and installing exercise equipment in the headquarters to encourage regular exercise among workers. Regular fitness events are organized by health directors, so workers and church members have opportunity to join events such as fun runs and others. Fitness programs are followed not only by workers, but in elementary, secondary, and tertiary schools as well. NPUC's Heal Thy Lifestyle program is a church-based lifestyle modification program designed to help members achieve lifetime health, fitness, and functionality. To date, 27 trainers in 55 districts in all 6 missions and conferences have completed the program. On the mission and conference level, the Central Luzon Conference has developed an extensive health lifestyle modification program for workers, teachers, and literature evangelists called PALM, or Program for Adventist Lifestyle Modification. On the individual level, health professionals in NPUC have organized into health clubs. They assist in all health activities in cities, provinces, and municipalities and serve as health promoters. Veggie-Capable is a new vegetarian nutrition promotional program launched in SSD. The 3-day classes focus on practical cooking demonstrations and health presentations. The schedule is packed with activities like menu planning and up to 9 hours of cooking classes. Training has been held in 7 of the 9 unions, conferences, and missions. Veggie-Capable for Kids will soon be launched to reach the youngest of church members, who are the next generation facing chronic diseases. Deployment of medical missionaries in cities and unentered territories is one of the prominent programs of the Health Ministries Department. Since 2010, Myanmar Union Mission has conducted 15 medical missionary training sessions, with each session averaging 8 months. MYUM has produced 118 graduates who have found employment in government and private clinics or were sent as medical missionaries to different regions. SPUC has trained more than 200 health promoters, some of whom served as local church health educators. NPUC held 25 training batches in its missions, and medical missionaries in Mindoro have opted to stay for another year because their work resulted in 49 baptisms and they want to continue to reach others. Stories such as these are many, and the impact of medical missionaries in missions and conferences in East Indonesia, Peninsular Malaysia, Central Philippines, Bangladesh, Timor, Sri Lanka, and West Indonesia are inspiring. Health clubs, wellness centers, and vegetarian restaurants have been established as the result. Some medical missionaries even go to places where Bible workers are not welcome, such as in certain Muslim territories. For the past 5 years, SSD has supported a multitude of medical missionaries who have reached thousands of people who need Jesus. This initiative has resulted in hundreds of souls for the kingdom and a renewed desire to reach many more in the next quinquennium. Adventist Community Services in SPUC partnered with local health workers and nutrition experts. They provided a 3-month-long feeding program for over 1,000 underprivileged children in different areas. CHIP is another outreach initiative, and it focuses on the prevention of chronic and cardiovascular diseases. It is now regularly conducted in NPUC, particularly in the Manila Adventist Medical Center and the Philippines Publishing House, or PPH Church. 2 of the 30 successful CHIP graduates from the PPH Church program recently joined the church. Temperance is one of the banners of the church to assist those struggling with dependencies upon tobacco, alcohol, and unhealthy substances. Smoking cessation clinics in MYUM and other unions have helped many smokers in their struggle to quit. Throughout the SSD territory, government departments, non-government organizations, and religious groups have recognized Adventists for their effective temperance programs. In collaboration with top government leadership and health agencies, many cities, towns, and villages were declared tobacco-free through Adventist initiatives. This is very prominent in the Philippines. The 3 unions contributed to the declaration of more than 20 towns and cities as tobacco-free. Today, the country's Center of Health Promotion is a close ally of Adventists as a result of health education and smoking cessation programs. Health expos are an integral part of many ongoing church-based community outreach programs. Almost every evangelistic campaign in SSD countries has featured a health expo. In the Central Visayas, hundreds of IEL care groups led thousands of their cared families to a conference-wide health expo. In Bangkok, health expos have attracted attention from high government officials as well as the intended communities. Sri Lanka Mission's health emphasis focuses on other religious groups such as Buddhists. This is also true in Pakistan, as the health message is shared with Muslim children in schools and other communities. As part of the Mission to the Cities initiative, SPUC conducted health seminars for professionals, businessmen, and the elite in different cities. More than 100 people accepted Jesus. Whether in Bangladesh, Cambodia, Malaysia, Myanmar, Indonesia, Philippines, or Vietnam, health expos are one of the best tools to reveal what Adventists can offer in the community. In Singapore, the Adventist Community Service launched a community outreach ministry for elderly and less privileged residents called Pay It Forward. Church members trained in health promotion offer free health screenings and distribute food baskets. These many diverse health programs are the streams that bring relief to people thirsting for physical and spiritual healing. Here in SSD, we continue to bring that source of life to them through the health ministry that flows from our heavenly wellspring, Jesus.